Federal agencies spend more than $61 billion from contracts to respond to the pandemic. But those agencies canceled $4 billion of contract obligations. Marie Mack is Director of Contracting and National Security Acquisitions at the Government Accountability Office. GAO has a new report on COVID-19 contracts. Marie, welcome.
Thanks for having me today.
So because of the pandemic, there was a substantial rise in the number of contracts awarded to vendors that didn't have prior experience working with the federal government. How big of a rise in that did we see in calendar year 2020?
Well, just a little bit of broad context when it comes to the significance of federal contracting. As you mentioned, at the end of May, there's been over $61 billion in contract obligations just in response to COVID-19. Just to put that in perspective, it is more than 7 times what was reported in terms of contract obligations for the response of hurricanes Harvey, Irma, and Maria combined back in 2017. So there's been a lot of money being spent.
So what impact did it have, Marie, on the process, given that you had so many vendors that had never worked with the federal government before?
I think when it comes to contractors that haven't worked with the federal government, we did hear from some of the selected agencies in our review that one of the challenges they experienced, in part due to the magnitude of the pandemic, was they were working with vendors that they had not previously worked with and buying supplies and services that they don't typically buy. For example, while FEMA and U.S. Army Corps of Engineers have extensive disaster contracting experience, these agencies typically aren't buying personal protective equipment or building alternative care facilities as part of their typical mission. And the other point is that agencies did award about 5 times as many contracts to vendors without prior federal contracting experience in response to the pandemic as compared to prior calendar years. And hopefully some of these contractors will continue to work with the federal agencies in the future. But that's just one challenge out of several.
So how did it go as far as evaluating new vendors, right? Because there's tremendous pressure to get these products and services out very quickly during an emergency.
Right. And again, to lay a little bit of context, contracting officers at the selected agencies identified, beyond just working with new vendors, the lack of contracting personnel for the volume of the awards, working with vendors new to federal contracting, limited timeframes to make awards, for example, and then, as I mentioned earlier, buying supplies and services that the agencies typically do not buy. But ultimately, one of the ways contracting officers can address some of these types of challenges and risks that they face during an emergency when they're doing contracting, particularly of working with vendors that they haven't worked with before, is this process of responsibility determination. And that is a required step where contracting officers determine if the prospective vendor, for example, has adequate financial resources to perform the contract, has a satisfactory performance record, and is able to comply with the proposed delivery and performance schedules. To make this determination, contracting officers that we spoke with use a variety of resources. They use government databases, private sector resources, assistance from other federal agencies, or even their own agency-created resources to assess these prospective vendors. However, some of the organizations, our major finding was that some of these organizations had limitations in that they didn't have access to, or they were not aware of the resources available to them, or didn't have any agency-specific guidance or training to leverage when it came to assessing these prospective vendors during this emergency.
So how do you think the pandemic has reshaped some of the federal agencies in working with medical-related contractors? You know, you said that we've been working with people that we've never worked with before and products that we've never had to use before. So how does that reshape the agency?
Well, hopefully that the agencies have reached out to a lot of these are on contract to vendors who have not had experience, and hopefully these contractors will continue to work with the federal agencies in the future. But it's important to have some of the challenges that they faced be addressed. For instance, even from a government-wide perspective, the Office of Federal Procurement Policy, which is under OMB, they provide overall direction for procurement policies, regulations, and procedures. And they obviously also promote economy, efficiency, and effectiveness in acquisition processes. This office had issued an emergency acquisition guide that outlines a number of management and operational best practices that agencies should consider during an emergency. But the biggest problem with this guide was it did not address the obstacles that contracting officers indicated to us related to assessing these prospective vendors under urgent timeframes and working with new vendors. So that guide, we believe, needs to be updated to continue engaging these vendors who don't typically work with government. And it wasn't updated since 2011, so many of the resources that are in that guide aren't even active or operational anymore.
So do you think now that agencies, and to a certain extent vendors, are better prepared to deal with national emergencies when it comes to contracting and procurement?
I think the experience of anything has taught us that we need to have guidance in place, training in place. We need to have some of these types of things in terms of updated availability. Contracting officers need to be able to know what's available to them to be able to address that responsibility determination. And if they address those recommendations we made in this report, that'll be a big step in that direction.
Okay, Marie, thanks very much for being on the program.